With me in the studio is medical doctor Tuyi Mebawondu. Thank you very much for joining us.
Thank you for having me.
Doctors, public sector doctors in private practice. Now, the government has placed a ban at a point, but we still see this happen. Why?
It's a needless controversy. I don't know why government will wake up and think that the best way to further the health system is to place a ban on medical doctors. Let's go back a bit. In 1992, it was signed and agreed that doctors can do what we call extramural practice. Okay. That means that during your free time, you can then, go and do practice. Look at the country. We're having 260,000 deficit of doctors. If we are producing 10,000 doctors every year, it takes about 25 years to meet that up. Now, we have just 35,000 doctors catering for as much as how many million? 200 million people. If you are looking at specialization, the whole of the country has less than 20 neurosurgeons. Yeah. So again, now, how do you now want to deploy the health system in such a way that, it can reach every part of the country? And you see the skill mix, you see the distribution of the doctors. Why now? What is the government has to gain from that? If you look at it from the Hippocratic Oath, you are mandated to provide service to people, no matter they're not specifying where you're working. Secondly, the code of ethics that governs the Medical and Dental Council allows you to do that. Now, people are talking about...
Allows you to offer service or engage
yes, yes, it does. The code of conduct, when you are not at government work, it allows
Well, we see a lot of public sector doctors refer to their patients to their private hospitals and leave the public sector hospitals to their private hospitals to attend to patients.
You see, tell you what, I think what needs to be done is to look at the process. The whole process of public hospital service. Even, as big as Lagos State is, the number of doctors working in Lagos State, they're not up to 12,000. No, sorry, 1,200. They're not up to 1,200 for the whole 20 million population. So again,
it's overwhelming.
Now, how do you now get to even the rural areas of doctor? What government should be looking at is how to create synergy between the public doctors and those in private. They've think of public-private sector participation, but we should also think of private-public sector participation because there are clearly areas of challenges in health system, and we know that the public doctors cannot do all those things, and at the public setting, they need to actually be able to move to other part and do it. What government should be saying that how do we interact with them? How do we ensure that at a point, these doctors can also offer some of those services.
So how can government interact with private sector doctors, especially those who move from public sector, who have public practice and engage in private practice as well?
For instance, let's take Lagos as an example. There are parts of Lagos that the presence of even ordinary primary health care are not felt, except some doctors offering service there. What is wrong with government saying that, listen, here we have high maternal mortality, we have high infant mortality. We are not reaching here because we are constrained by the number of doctors we have. This private hospital, can you provide service in such a way to reduce this incidence of this thing, and we then can give you some compensation. Integrate them in such a way, set a standard for what they need to do, and reclassify them according to the kind of service they are offering. There's no way government can sit down and say, wait a minute, we are providing all the healthcare need for the system.
If government is to take your recommendation, how will that improve the health sector?
It will surely improve the health sector. Look at it, 35,000 doctors, mostly concentrated in practicing in Nigeria, 200 million people, mostly concentrated in urban areas. How do you deal with those people in the other areas? It will surely do, because what it means is that the large number of people that are crowding the public sectors, public hospital, will also have nearly the same or even greater quality at the private sector that is being integrated into the government system in a way. Now, that means that the doctors in the public sectors who are poorly paid, who are overworked, will have more time to actually focus on that. And then, what then you do? Because if in a place like India, this thing has been settled. Sometimes we need to take some of these things and test in the court of law. The Supreme Court ruled that, you see, doctors, even there, can practice when not in government work. So, because you don't want me to work as a public doctor in a private setting, now I have issues. I have to render, let's say, a specialized service in a private setting. Then you want me to go away? No.
So it means that whatever the case, it might not work.
it's not going to work. How can you say, is farming not work? How can you now restrict doctors to farming? What does that, are doctors trained to treat crops?
Some doctors are farmers, though.
Yeah, again, because it can't be you doing the farming. Right. It has to be somebody doing the work for you.
All right, Dr. Tuyi, thank you very much for talking to us.
It's my pleasure.
Our discussion now in the studio with me is medical doctor Tuyi Mebawondu. Thanks, doctor, for joining us on the program today. Let's take it off from the tail end of that introduction where it's alleged, it continues to be an issue that doctors who work in public service still have this clinic they run to. The question now would be the level of professionalism in that wise, if you agree, though. It's been said, though, that in these private hospitals, they are not at the same level with the public hospitals.
Again, there are many private hospitals that will dwarf public hospital at any point in time. Let's look at it. The thing that can motivate doctors to want to stay in government hospital includes 1, remuneration, 2, the level of trust that exists between the doctors and the employer. And you've seen, a strike too many because of this kind of distrust. And then government can wake up today and say, okay, you are no more in the employment, and then create a lot of challenges in terms of security of jobs. Now, besides, the medical ethics and the Hippocratic Oath is the standard, is the gold standard that directs doctors' interventions in everything in life. So again, you look at it, even the quality of the provisions and the processes in the government hospital, some of them are questionable. People may have to wait for a lengthy period of time to get something done because of the sheer number of people that are involved. And thirdly, we're seeing maldistribution of medical practitioners everywhere. All of them concentrated in this tiny city. The other part of the city, nobody is there. So how do you now wake up and tell doctor not to honor the Hippocratic Oath, not to honor medical code, medical ethics of rule defined by Medical and Dental Council? How will the government just wake up and say, okay, the only thing you can do is farming? Why will you now prescribe
okay,
for doctors?
In law now, the Constitution is the ground norm. Any other law that is inconsistent with it, is null and void. In the medical line now, we're having, will I call it a presidential directive now, so to speak, saying doctors can only farm when they are not in the hospital. But then there is also the law which binds medical doctors that says, so this controversy doesn't help. As in, why are we having the controversy, federal government versus the medical doctors code?
Again, I think the federal government is just, if I may use the word, chasing shadows. Why? Number one, you are not having sufficient doctors to run around your country. You are not having the right skill mix. You are not having the requisite number. Even the provision you are provided, the provision you have is deficient. Some other specialized things can be done better elsewhere. I think the great thing is to look at honestly, how does all this thing feed into the healthcare delivery system? If you are having challenges in terms of quality of doctors' performance in the public hospital, raise that standard. You are supposed to be here by here, and you must have done this and this. You must be able to do what we call performance-based compensation, even at that level. But for you now to wake up and say, listen, because you are working with me, once you are on leave, once you are not working here, you cannot touch life. That is wrong. I think we should, again, like you mentioned, the conflict between the Constitution and this code of ethics, we should be able to raise this standard. I expect some doctors to stand up and say, listen, court, come and determine whether
which is binding on us.
Yeah, which one should be binding on us. Because it has been done in India. 2 doctors took the government to court. I said, listen, we are not, what we are doing is proper.
Doctor, and then there is also this rivalry between the public and the private doctors. We've seen cases of referrals now. Something goes wrong now. Somebody is referred to the public hospital. There is this sense, I'm talking again from a point of view of a doctor in a private service who says, okay, there's this rivalry. Okay, the doctor in the public service now says, that's a sham. The doctor in the private service did a terrible job. There is this rivalry. How healthy is it for the practice, for the patients especially?
Even within public hospitals, there are rivalries, okay, as it is. Now, there are standards, and these are the standards we should try to impose, okay? And then there are a process of referral. Most Nigerians don't want to go through the referral process. Ideally, the place you should have come in first is to the primary health care center, who will now look at you and feel that you qualify for secondary. Secondary will look at you and feel that you qualify for tertiary intervention. But what people do most of the time is to go to the secondary center or even the tertiary center and be seeking treatment in that way. So, and then in our own part of the world, we see a lot of delays, you know, a lot of delays where people have all sorts of delay stations trying to seek healthcare. By the time they get to a private hospital who feels that, well, there are issues, go to this place. Because you know what is driving that? One, it may be the finance. Two, sometimes it may be the combined expertise needed. Because at any point in time, a doctor must understand his limits and say that here and no further, I need to send to a place where we can have a combined intervention. But then we still
get some sharp practices along the line.
Yeah, it's not about sharp practices. I think this government's decision is ill thought out. There's no way to define it, you know, because government in the past has allowed and decreed that doctors can do extramural practices. So why the reversal now? When the number of doctors are dwindling, when you cannot train sufficient doctors, when you cannot compensate them appropriately, when consistently you are in contact and conflict with them, you know, repeated strikes.
So for you, this is not helping the doctors
in any way at all.
It won't help
patients, it won't help doctors.
Dr. Mebawondu, thank you so much.
Thank you.